Hello, I'm Camila Skaf, and I'll be sharing with you the story of lifestyle medicine. Right now, we're living in the middle of a global COVID 19 pandemic. Our efforts are revolving around vaccines, treatment protocols, medications. But running parallel to the current crisis is yet another kind of pandemic that existed long before COVID 19 and will continue to exist long after the current crisis is overcome. It's the pandemic of chronic diseases. While human ingenuity and hefty investments in vaccine research are our current best efforts in tackling the COVID 19 crisis, chronic conditions such as cardiovascular diseases, diabetes, dementia, cancer, obesity cannot effectively be dealt with vaccines or over the counter medications. Rather, the best solution to this hidden pandemic seems to be in adopting healthier lifestyle choices. This realization gave birth to a relatively new field of study, lifestyle medicine. In this presentation, we will explore the origins and development of this fascinating field of study. Let's start by a quick overview of the history of disease. From ancient times until the beginning of the 20th century, the biggest killers of humanity were germs, wars, and accidents. While the later two could be managed by means such as diplomacy, bigger armies, or safety protocols, little to nothing was actually known about the nature of or even the existence of microorganisms. It was very hard to fight a battle with an invisible foe. However, some scientific breakthroughs obtained by either providence or chance were going to change the battlefield against germs forever in our favor. First, vaccines. Edward Jenner noticed that milkmaids previously infected with cowpox were often immune to the smallpox virus. To test this theory, he infected a healthy young boy with cowpox and 6 weeks later injected him with smallpox matter. Courageous boy, isn't he? As he expected, the boy did not contract the disease, thus confirming his theory. This experiment would be the precursor of the first vaccines. Later in the 19th century, French scientist Louis Pasteur would greatly contribute to the cause of fighting diseases by developing the beginnings of the germ theory. Another proverbial silver bullet on the war on germs was the development of antibiotics. With these beauties mortality rate from infections fell over 60% from over 60% to about 11%. The first antibiotic was discovered purely by accident. Scientist Alexander Fleming was doing some research on cultures when he noticed that one of his culture on a petri dish was completely dead. Fleming learned that these bacteria were killed by a certain kind of mold, which he eventually would isolate and mass produce under the name of penicillin, the precursors of our modern day antibiotics. In addition to Jenner, Pasteur, and Fleming, there were other men and women that made significant contributions to our knowledge on how to fight infectious germs. Florence Nightingale, who had great ideas like cleaning her medical equipment and serving patients with clean water, keeping the environment tidy, and giving them fruits to eat, drastically decreased mortality rates during the Crimean War in 1854. Ines Semmelweis, who discovered the wonders of washing hands in preventing maternal death rates. He was so ridiculed by his seemingly absurd ideas by his medical peers that he ended his days in a hospice. But now, this man is recognized as a savior of mothers. So, thanks to these discoveries, a new pattern of epidemiology is started to develop. For some reason, life expectancy didn't increase as much as expected. In 1971, Dr. Ormran coined the term epidemiological transition in a paper that described how degenerative man-made diseases displaced pandemic of infection as the primary cause of morbidity and mortality in many high-income countries. Yes, with all of this, the mortality rates were not they were decreasing, but the life expectancy were not increasing. What could be holding us back? What happened is that a lot of people in the world were not dying so much from acute and infectious disease anymore, but more and more men and women were dying from other conditions such as heart diseases, cancer, and diabetes. The so-called lifestyle diseases that were provoked by risk factors such as tobacco, dietary patterns, alcohol, as we can see on this slide. Trying to understand this new trend, a number of studies emerged trying to find out what was causing these new type of diseases. One of the earliest studies, known as the Framingham study, started collecting data in 1948 from over 5,000 subjects that were residents in Framingham, Massachusetts. It was one of the first papers to show a clear correlation between diet, cholesterol, and heart disease. Later, in 1976, a famous Adventist health study followed 34,000 people, 70 Adventist people, for 12 years, showing the positive impact of lifestyle choices such as not smoking, eating a plant-based diet, and exercising regularly as being protective from certain types of cancers, type 2 diabetes, and cardiovascular diseases. One of the findings of this study was that healthy habits could account for differences up to 10 years of life expectancy among Adventists. Another important groundbreaking study in the field of lifestyle medicine worth mentioning was the China study, a 20-year study which compared diets and mortality rates between 65 countries and 130 villages in rural mainland China. This study showed that the mortality rate from coronary artery disease and some cancers were strongly correlated to diet. With significant research development, we continue seeing evidence that lifestyle choices, including diet, smoking, and exercise, were determinant factors in the onset of chronic diseases that were pervading our planet. While those studies started to emerge only in the second half of the 20th century, some visionary men and women were able to capture the link between lifestyle and health much earlier than this. For instance, in the 1800s, Dr. John Harvey Kellogg advocated for vegetarianism, regular exercise, plenty of fresh air and sunshine, drinking 8 to 10 glasses of water per day, and abstinence from alcohol, tobacco, tea, and coffee. He's most known perhaps for the Kellogg breakfast, cornflake cereal, granola, and peanut butter that revolutionized the American and much of the world's breakfast culture. Kellogg was much influenced by one of the founders of the Seventh-day Adventist Church, a woman by the name of Ellen G. White, who wrote much on the topic of health. For instance, in her book The Ministry of Healing from 1905, she wrote much of what was only acknowledged many decades later by science. Another important pioneer of the field of lifestyle medicine was Nathan Pritikin, an inventor with a passion for nutrition and fitness, who since the late 1950s was promoting that mostly vegetarian diet and exercise, instead of drugs and surgery, should be the first line of defense against cardiovascular disease. The term lifestyle medicine came much later than these pioneers, and it's evolving together with the evidence about its relevance in today's healthcare solutions. Dr. Darren Morton, one of the lifestyle medicine pioneers in Australia, defines it as the application of therapeutic lifestyle interventions to influence chronic disease prevention, and progression. So now, how relevant is lifestyle medicine in a globalized 21st century? Could that be that all of these lifestyle factors are attached to risk factors that are causing obesity, metabolic inflammation, and all of the diseases that are leading cause of death in the world? Lifestyle medicine offers a unique contribution to our healthcare system, particularly in preventing, arresting, managing, and reversing chronic diseases. A brief overview of a few landmark studies in the area will help us to answer this question. The Interheart study, which has already been cited in medical literature more than 14,200 times, analyzed risk factors associated with myocardial infarction in 52 countries, representing every continent, with around 30,000 participants. This study revealed that the most important risk factor for myocardial infarction were smoking, abnormal lipids ratio, history of hypertension, diabetes, obesity, psychosocial factors, daily consumption of fruits and vegetables, and regular intake of alcohol, and regular physical activity. Another landmark study was that the Nurses' Health Study, established in 1976 and now in its third generation, having enrolled more than 280 participants. The nurse studies helped uncover early links between cigarette smoking and cardiovascular diseases, and between postmenopausal obesity and breast cancer. A third landmark study worth mentioning is the APIC Post-Dem study that was done in the 1992 until 2000. That was involving over 340,000 individuals, massive, men and women between 25 and 70 years of age. This study was the first to simultaneously investigate all relevant food groups in relation to major chronic diseases, about 45 food items in total. All those massive studies and other revealed that the connection between lifestyle and the onset of chronic diseases beyond any shadow of doubt. It is known today that lifestyle medicine can even help to change human genetics. Lifestyle medicine, therefore, offers a unique contribution to our healthcare system by offering a whole person health approach. This can be achieved primarily via educating the community about healthy and safe habits, such as eating well, not smoking, and exercising regularly, as well as in promoting support groups to motivate and facilitate lifestyle changes. Lifestyle medicine can also educate patients on how to manage their existing chronic conditions such as diabetes, obesity, arthritis, and depression. There are several great examples of successful lifestyle medicine based intervention programs that have been able to impact all of areas of health. Dr. Caldwell Esselstyn piloted a program where he took 19 inoperable patients with coronary heart disease and put them on a rigorous lifestyle intervention program. 12 years later, none who continued the lifestyle changes died, nor experienced another cardiac arrest. Dr. Hans Diel, with the Complete Health Improvement Program, known as CHIP, a widely published community-based program which promotes education in nutrition and physiology, as well as volunteer-led support groups for participants, and has become notorious for its proven results. And Dr. Dean Ornish contributed with studies like his 1990 study showing that arteriosclerosis could be reversed through intensive lifestyle changes, and most recently he launched his new program, Undo It, It's a program that has achieved Medicare claimability in the United States since 2010. And this program has shown to help people to reverse chronic disease, even dementia. What a remarkable accomplishment. For lifestyle medicine, the future is now. Practitioners of this field hope that it will become an important part of any therapeutic effort offered to a patient, being a key piece in a whole person health approach that combines traditional biomedical and cognitive behavioral interventions with nutritional and personal story elements. Lifestyle medicine will also benefit from technological innovations such as online interventions and genomic and online interventions and integration with apps, personalized and genomic medicine, all of which will prove and provide access to connect the health professionals and patients to more efficient, sustainable lifestyle medicine and healthcare model. Finally, in the future, lifestyle medicine practitioners hope to educate the broader medical, political, and general community about its findings, thus conducting more research and incorporating lifestyle medicine principles into the life of patients. I hope that you enjoy this presentation. Sign up for a free newsletter to receive more lifestyle medicine solutions resources at seedsnewcastle.com.au. Thank you.